Welcome to our another lecture. Subject Anatomy and Physiology. Topic Body Quadrants and Regions. For first year students, Diploma in Nursing Science and Midwifery, Diploma in Midwifery and BSc in Nursing course. Presented by BD Nursing for You. Learning objectives. Upon completion of this online class, students will able to understand the concept of body quadrants and body region, identify the different types of body quadrants and body region, list the organs of 4 quadrants, list the organs of 4 abdominopelvic region. Body quadrants. Quadrants are another way our bodies are divided into regions for both diagnostic and descriptive purposes, mainly upper quadrants and lower quadrant. Then both are divided into right and left. See the figures. Abdominopelvic quadrants, right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. Sagittal plane, transumbilical plane. List the organs of 4 quadrants. Right upper quadrant RUOJ, right lobe of liver, gallbladder, part of the transverse colon, part of pylorus, hepatic flexure, right kidney and duodenum. Right lower quadrant RLQ, cecum, ascending colon, small intestine, appendix, bladder, if distended, right ureter, right spermatic duct, men for men, right ovary for women, right tube and uterus if enlarged for women. Left upper quadrant LUQ, left lobe of liver, stomach, small intestine, transverse colon, splenic flexure, pancreas, left kidney and spleen. Left lower quadrant LLQ, small intestine, left ureter, sigmoid flexure, descending colon, bladder if distended, left spermatic duct for men, left ovary for women, left uterine tube and uterus if enlarged for human. Body regions. The principal body regions are axial region, appendicular region, abdominopelvic region. Axial region, head, neck, torso or trunk, thorax plus abdomen. Appendicular region, upper and lower extremities. Abdominopelvic region. The most widely used terms are those that describe the 9 abdominopelvic regions. The 9 regions of the abdomen can help determine specific alignment and are of clinical importance. Notes: 3 horizontal lines and 2 vertical lines create 9 regions of the abdomen. Below this an image of the region of the abdomen which are formed within these planes. Hypo refers below, epi refers mean above. Chond refers to the cartilage of the rib and gassed is in reference to the stomach. There are 9 abdominopelvic regions. First, right hypochondriac region, right lumbar region, right inguinal region or iliac region. 4. Epigastric region. 5. Umbilical region. 6. Hypogastric region or pubic region. Left inguinal region or left iliac region. Left lumbar region. Left hypochondriac region. Abdominopelvic region. The regions are named below. Right hypochondriac region, right hypochondrium, right lumbar region, right iliac region or inguinal region, epigastric region or epigastrium, umbilical region, hypogastric or pubic region, hypogastrium, left hypochondriac region or left hypochondrium, left lumbar region, left iliac or inguinal region. Contents of 9 abdominopelvic regions. The right hypochondriac region, right lobe of liver, gallbladder, upper part of right kidney, hepatic flexure of colon, right adrenal glands. The right lumbar region, ascending colon, part of liver, part of duodenum, gallbladder, lower part of right kidney, right ureter, part of coils of jejunum. The epigastric region, pyloric part of stomach, part of pancreas, duodenum, part of liver, aorta. The umbilical region, part of stomach, transverse colon, part of duodenum, head of pancreas, part of jejunum and ileum, part of right and left ureters. The left hypochondriac region, stomach, tail of pancreas, upper part of left kidney, splenic flexure of colon, spleen. The left lumbar region, descending colon, lower part of left kidney, left ureter, part of coils of jejunum. The right iliac region or right iliac fossa, part of ascending colon, appendix, right ovary and right fallopian tube in female, right vas deferens in male, part of right ureter. The hypogastric region, urinary bladder, rectum, part of sigmoid colon, coil of small intestine in male, prostate, vas deferens, seminal vesicle in female, uterus, part of left and right ovary, round ligament. The left iliac region or left iliac fossa, part of descending colon, sigmoid colon, left ovary and left fallopian tube in female, left vas deferens in male, part of left ureter. Now U-turns. Written assignment: draw and label the 9 abdominopelvic regions.